Earlier this week, the Institute, through its Population Health Observatory, launched 2 large data sets. Can you tell me about what you did?
Yes, it was quite a big event. What we did is we actually brought together over 80 measures of health and well-being into one very large data set. And we collated that information for every county in the south and every local government district in the north, and put that data set onto the Observatory's website, so that anyone who has access to the internet can get onto that website and use the mapping and charting tools to explore that data set further.
What were your reasons for doing this?
We had a couple of reasons for doing it. Clearly we're very keen to stimulate debate about the variation that exists on the island in health. So perhaps more importantly, what we wanted to do is to provide some information to help health planners, either at the local or the regional or the national level, to tailor their health and social services to local needs. And we're interested not just in addressing current health needs, but also trying to build a healthier future. So that data set contains indicators that cover a broad range of issues, including those which usually sort of referred to as the social determinants of health.
So, you've said a bit there, so how is this data going to help?
This, what we've started to do, and we've only just started this process, we're starting to put together a fairly comprehensive picture of health and well-being in each of the areas across the island. And because we've gathered this information in a standard way across the 52 counties and local government districts, it means people can fairly confidently compare their region to another. So the idea is that as well as getting more of an understanding of the local situation, they'll also be able to compare it to other places, and if there are areas that appear to be doing better than their own area, then perhaps they can look at what's going on there, and perhaps there's some lessons there that can be shared.
Can you briefly tell me a little about what you found?
What we found was that there was a very substantial variation in many of these indicators across the island. For example, one that's received a lot of attention was life expectancy. And what we found there is that across the island, life expectancy ranged, say for males, ranged from a high of 78.1 in Ballymoney in the north, down to 72.8 years in County Leitrim in the south. Now this is a range of just 5.3 years, which is quite substantial indeed. For example, it's as large as the gap between males and females, and it's very much bigger than the gap between life expectancy on this island and the rest of Europe. So these are very substantial sort of gaps, and what we hope is that this data will help us to try to understand these differences and try to reduce as much as possible these inequalities that cross the island.
Are you able to explain any of these findings?
Yes. As I said before, it's quite a large collection of indicators, and they go some way to explaining why one area might be different than the other. But what the data reveals was that there's a complex. That these variations are often the result of complex interactions of a range of factors. And this data itself is very useful for helping us to understand that, but it's only the start. And what we want to do is, over time, is to build up these 2 data sets so we can get a more complete understanding of health in the local areas.
So this is a large data set. Are there any pitfalls in using it?
Yes, it's a large data set dealing with a really complex sort of issue, and there are many sort of pitfalls, so people need to be careful when they're using it. What I'd like, one pitfall I'd like to sort of emphasise is the notion that these data actually provide a snapshot, and it's a snapshot of particular areas at a particular point in time involving the current residents. And we all know that that there are many things that affect our health which start very early in our lives, even before birth, and their effects accumulate over time. So if you don't take that into account, if you don't take what they call a life course perspective to this data, then you're not going to be able to explain the geographical variation in these indicators simply by the current circumstances in those areas.